يشبه شو اسمه مرة نشوف الدكتور رخصان عبالي هون تليفوني تذكريان موجع براسي ليش عفتي اخذه هذا ضايع شو طلعي خلنا نشوف التصوير ترى نزلت يوتيوب يلا
Sure. Just give me a second. Okay. Did he catch a cold before this problem?
Yes.
For how long? How long before? It's 3 months?
3 years.
3 years. And so it's for 3 years. What is that?
After that, he go to the private clinic.
Private clinic. And right now, can he can close his eyes?
Yes, doctor, the condition is improved.
Okay.
After 1 year.
So there is no.
But now the some symptoms repeats, like
Can he close his eyes in this way?
this eyes.
Just a little bit.
Yes.
Oh.
Drop.
Use any drop. Use drop, daily drop.
Yes.
Very important. Use it times by time, at least 2 times, 3 times per day. Okay. What about the mom? The
Drop from here.
oh, how long? 2 months? 2 months ago? From since when?
Months ago.
4 months?
Yes.
And he went to the professional doctor again?
Yes. No, doctor. No.
The same side? Same side?
Yes. I have this picture for first
Is it new or 1 month ago? For the past? Okay. The name of doctor is Dr. Tashrin. It's close. This picture.
For 5 the condition is
So it's okay. Yeah.
but now repeat the same symptom like the
It's your turn. Again, it got the kind of injury. It doesn't refer actually past icons. You got it again. I will let you know. Especially on both sides are passes, but comparatively liquid. Does he feel any kind of pain? Sorry. Does he feel any kind of pain?
بس خلي اجيب مي لعد متى تعطل
غيروا يا حبار.
متى بعد مي
Chef, bring another yes. So why is it interesting for her? He got what?
اللي هناك بعد
Okay, anything else? And what is blood? What's the date of this actual report? What's the date of this report? Finally, what is it? Oh God. Turn it on, please. Turn it on. Okay, okay, good. Okay, and it belongs to when? 8. 2021.
First,
So I thought that probably this is new one.
no, doctor, no.
What is the new one? Where is the new one? Didn't go for the new one?
Yes.
Didn't go anywhere? Why?
Just take this medicine from 3 years every day.
You mean we bought it again and repeated again? You need a kind of this actually. You need it. What can I see? I know. You know, are you doing anything for him or no?
No?
Yes. From 1 month, he had the experience of 1 month, right now.
Yes.
And you didn't do anything for his visit. Sorry. And is he okay to come to the hospital? Or Zainullah in New York, in Zainullah right now? Okay, is he okay to be there and get some of the suggestion idea, and also it will be possible for the students to watch him? Okay, no. So probably just a private place with you and me and probably him. We can set a time for him. You know, you must provide some of the exercises for him. It helps to provoke to the normal situation. Okay, just some simple exercises, very good. He needs this assessment. He needs it. And he must try to get it. And just
هو تطورت الحالة طبيعي تسأل بالشارع هذا الشارع اي ما حسيتها؟ لا دكتور exercises for himself
who learned him?
therapist when he
Okay. Which kind of exercises he's trying?
oil, put it oil on the face and massage like this.
Okay. And the other exercises, okay. You're not laughing, okay? In front of mirror.
Yes.
In front of mirror laughing, and then provide a kind of actually sadness, something like that, nothing sadness. In front of mirror, try to make it balance between two parts, and close the eyes firmly. Open the eyes again. Close the eyes. It's much important. Close the eyes firmly, and nose. Have a look at me. Nose. Bring it up. Bring it up. And get air on the area. And also try to provide a kind of air from the mouth, something like that. Use their palm around the leg. I know. And this way, keep the air on his mouth. Doesn't let you take it out. And also, this one I told you is very important. Eyebrow is very important. Eyebrow. And you can use the electrical stimulation as well. I'm not sure, is he going to the physio? Electrical stimulation, right? Why?
Because the condition is improved.
So if it's improved, so if it's normal, it's okay.
But now,
You say that actually there are some signs for him, right? So if there is some signs for him, you must go to the treatment as well. And for the treatment, for the physio treatment, they are very important that you use a kind of a stimulation in 4 muscles, small muscles. Please remember the name of the muscle. Orbicular oculis, orbicular oculis, orbicular oculi. How are you?
Fine.
Orbicular oculi, corrugator superciliis. This is nasalis, and corrugator superciliis here. Is for the two eyebrows. You must use which kind of electrical stimulation? It's just the IVC. It's just actually the long duration, not short duration. Did they use a kind of a simulation as well?
Yes.
Yeah. No, he got the problem again. It doesn't refer to 3 years ago. He got the problem again.
Doctor, now we take go to medicine or what?
I told you, you need this kind of assessment. And the only person who can offer this one is a kind of neurologist. Dr. Shafi can do that. I'm not sure probably. Is he providing a kind of practice here or not in Iran? Because he is a neurologist in Iran.
You can't do that in the Zainal Abidin Hospital.
No idea that they have the devices that they can try for the patient. I'm not sure. Because in the specific tools, there's an NCV, nerve conduction velocity, EMG. This is a specific test, NCV and EMG. And what is that? It belongs to class? They are similar in the past, yeah?
Yes. All this and
But they need it, and it shows the progress of this patient. It shows the progress. This one.
After we do this again, we come to you?
Yeah, sure. The vacation is not done. It's not completed, the vacation. Please ask the students to come back. My pleasure. Hura, you don't go to the board today.
I have 10 minutes.
You don't?
No, I have 10 minutes.
You have 10 minutes. You're a great hard worker. Good job, good job. I want to see you in a high level of education. Master degree, doctorate of physical therapy, PhD level. Why not? You know, past week, you know how much I satisfied when I saw my former students at the dean of the faculty. And they made me so proud. They made me so proud. 3 of them were dean of the faculty in Pakistan. You can get it. Why not? You have a great stamina, you are persistent, you are a hard worker. You can get it. High five. Rohaya, how are you? Get a picture with this Jassim Al-Ubaidi. When I was a young high school lecturer boy, I got a picture with this. I got a picture in the laboratory of our high school. I think 15 years. Got a picture in this way. Okay, are you ready to come back? Okay, we are heading to talk about the upper end of the elbow, and the upper end of the elbow is including the ulnar bone. And you know the area referred to ulnar is the area which is involving the elbow joint is olecranon area. And where is the olecranon area? It's part of the lower end of the humerus, providing a kind of attachment for joint, which we call it the elbow. There are different methods of classification. Doesn't need to remember it always. Just have a look under. As you can see, we do have 3 different types of the fracture. And as you can see, in the time of the fractures, you can see type 1, type 2, type 3. And based on the type of the fracture, your level of disability, level of problems will be increased, gradually increased. Okay? So the level of problem is just a kind of fracture. Here is a kind of fracture and fragment, and here is a kind of fracture and fragment and angulation. And angulation. Okay? So you can see it here. You can see it here. What's happening? Okay. You can see it here. There is a fracture in olecranon area, and it look like a beak of the birds. It look like a beak of the birds. You know the meaning of beak?
Yes.
Manqab. Kalab. What is the name of kalab in Arabic? Crow. The black bird. Okay, it looks like a beak of the ra. Okay, so how look at this picture? There are two methods of stabilization. Okay, use a kind of, what is that? It's 95-degree condylar plate. It's a nail, simple nail, and some wire, Okay, there is a kind of stabilization with the wire, and here he used a kind of 95 degrees and some screws because the fracture is much complicated. And when you can see it, okay, there are lots of screws on there. 1, 2, 3, 4, 5, 6, 7, 8. 2 simple rule of biomechanics for the operation. You do know it, you do remember it. And what is these 2 rules? First, the width of any of these actually screws are at most 20% compared to the width of the bone. Okay? You do remember. And you mostly could use at most 5 of these actually screws because you can provide equal amount of the width with equal amount of the bone. This is 2 simple rules for using the surgery or if or something like that. Okay, it's very good. And you can see that there are 8 screws. And from biomechanical point of view, it's not correct. Why? Because it provides a kind of instability. For the area. But did the surgeon do a kind of wrong action? Not at all. Because it needs to provide a kind of stability for the area, immobilization for area. He didn't have any other choice. He must use it. He knows that probably the stability is not good, but he must do that to provide a kind of immobilization for the area. It's a kind of obligation, force. Okay? So when you see such a kind of fixation, you must provide your method of treatment, method of the physio, just easiest one, simplest one, not forced to reach it right at the time. You may postpone, you may delay, you may postpone. I heard some speak, but I can't find the source. Is it you? Oh, you're not laughing. You. Okay. Don't force this patient. Just think that actually you are not allowed to force anything. You may postpone some of the approaches. How much? 2 days, 3 days, 4 days, based on the assessment of the day. Okay, everything is set? Okay, what is the type of the healing process? Endochondral, intramembranous, both of them. You know that the intramembranous refers to the area of upper end or the epiphysis, and the endochondral refers to the compact bone to the body. And what about circulation is very good. And what about the expected time for healing is 10 to 12 weeks. It's about at most 3 months. At most for rehabilitation time, you have the 3 months as well. And the purpose of the treatment, you know that. You repeated it times by times. Alignment, stability, and routine. And also you know the purpose of the physical therapy. Pain. Don't forget pain here. Range of motion, muscle and power, and function at the end. Okay, how can we reach it? Easy, easy, easy. Okay, from the first day, for the first week, you can start with very gentle movement on the area above or below, on the wrist or on the shoulder, but not at the area of the elbow. So gentle active exercise for the wrist or for the shoulder. Do not provide any kind of harsh or full range exercise, even for elbow or for shoulder. The forceful or the full range exercise provide a kind of force for the area and lead to provide a kind of instability for the area. The most important thing is try to keep the stability as much as possible, especially in the initial stages. Okay, active assistive device in elbow for the flexion might be started at the end of the first week, and the range is something between 10 or 20 degree up to 90 degree, not more than that. Why? Because we are looking first for the functional range, and then after a while we are looking for the anatomical range. Okay, and you see that there, I wrote that you can do that if the fracture is going to be stable just in that time. And there is no forceful, there is no muscle strengthening exercise. And for the function, you need some help for dressing, nourish, or clean, and there is no weight bearing for this person. Okay. And the week 2 and 3, you can increase a little level of tension, increase the active exercises. Still, you have limitations, especially in rotation. And the strengthening exercise can be a gradual increase. And just for the isometric, you can start with the isometric on flexor. That means the lowest amount of the tension you are looking for. And still the function is not dependent, it's dependent to the people. Weight bearing is not possible.
Doctor,
Yes, please.
this active assistant, the first,
Yes, the first week.
no, first one, this
Active assistive, yes, active assistive.
assistant.
Okay, from the weeks 4 to 6, that means 1 month up to 1.5. So you are increasing the exercises heading to elbow. Heading to elbow. That is the time you can do the elbow. That means actually your fracture completely healed. When at least 18 to 20 days later, you reach third cortical bridging. We talked about that. Third cortical bridging.
Yes.
You got it? Okay, so, and there are some limited movement still available, but the most limited movement is in elbow. You are not allowed to force the elbow at all. You can use it, you can reach the movement, just a kind of active assistive range, something like that. And for the wrist, you have lower amount of the limitation, but be careful that the risk can provide a kind of instability for the area. You can do that as far as you are completely confident about the stability or healing process here. So the rotation, pronation, supination may lead to kind of instability. So do that whenever you are confident about the stability, 4 weeks to 6 weeks. And which range you can start? Outer range, inner range, middle range. Which range? Middle range. Good. You are a little growing. So no need to remember everything, to keep it on your mind. Just follow the scientific rules. You can get it, you can understand. Okay, no strengthening exercise. Imagine it's very small. So you can do the exercises. There is no actually exact borderline between the stages. So you did start a certain exercise earlier, probably 1 week later, and you can continue the exercises, strengthening exercises following. And it's including isometric, concentric, isotonic, and eccentric, anything else. Can we apply for the isokinetic here? No, it's too soon. Too soon. Just 6 weeks. Okay. You know, needs help for dressing, nourish, clean, gonna be a little smaller. So your patient is much independent right now. And functional stability exercise, you can do that. And weight bearing is still non-weight, but it's heading to the partial weight in this time. And from the week 6 to week 8, you can follow the situation. Gentle active exercise, active assisted elbow, wrist exercise, and stable fracture. A limited movement in elbow, so the limitation is going to be much lower. The muscles are actually going to be higher. You can increase a level of tension. Concentric, eccentric. Which one provides you better tension? Which one is much effective on the increasing power? Isometric, concentric, eccentric. Which one provide you higher level of tension? Much effective on strengthening? Great, Rohaya. Why?
They have high tension.
Increasing level of tension. That is the point. So, eccentric is not your choice at the initial stage. Okay, you can use it at the middle stage. You can compare it with isokinetic. Again, isokinetic is for the later stage. Last stage, more than eccentric. Clear? Okay. So, eccentric exercise provide you middle tension. Okay? So you cannot use it in initial stage. For initial stage, you have isometric. After a while, after a week, you have concentric. But you can use it in middle stage. But in the later stage, when you have a very powerful man, weightlifter, you want to increase the highest amount of the tension. Eccentric does not enough. You must go toward isokinetic. You get it? Okay. The function going to be okay right now. Probably he has, or he or she, I mean the patient can do everything right now. And while the weight bearing, right in this stage, he or she can get some weight, some level of weight. We call it partial weight bearing. And during the next or last stages, 8 to 12 weeks, you reach the full weight for sure. If you're gradually growing in this way, increasing level of tension, increasing number of the exercises, period of the exercises, and the muscles who are involving. What is the meaning of PRE? Mariam, what is the meaning of PRE? Progressive, resistive exercise. Progressive, resistive exercise. And when you are using it, you are passing exercise therapy 3, 2, right now? Or you pass it? You pass it before? And you do have 3 exercise therapy, right?
No, 2.
Just 2?
Exercise therapy, principle of exercise on PNF. Just.
No, you have another type of exercise therapy. I think it's focused on hemiplegia and CP or something like that. You started with Dr. Ansari. What was the course of? Sorry, let me have an idea. What was the course of Dr. Ansari?
Neurological.
I know. I'm asking your idea about his teaching level of quality of teaching. Are you happy with?
No.
Why?
Doctor,
we don't have communication.
yes, doctor.
He's brilliant.
Yes.
But you know, it refers to your background. How can I solve the problem? You can't understand nothing? You know, Dr. Ansari, there is a very famous item, we call it H-index. You know H-index.
Yes.
H-index, as far as you have higher level of H-index, it shows your ability in the research and how much you are involving with the high quality international collaboration or research or actually method of the creating data, I mean. Okay, Dr. Ansari does have the highest H-index among all physiotherapists in Iran. As his H-index is going to be at 32, 33, and his wife, which is coming after probably 1 month to you, like a Nandi, does have H-index of 26, 27, something like that. So they are much high quality. They have it. But why you are not satisfied, I'm thinking that how can you much be familiar with this concept?
Doctor, in 1 week we explain 10 lectures.
Just the 3 days.
And the class don't have any activity. And we don't have any communication with the doctor. The professor explain here on the slide.
And talk about the slides.
Yes.
Just
Very
fast.
fast.
Explain. Without explain. Just say.
Very fast.
Very fast.
Yes, very fast.
Just the 3 days, he explained 10 seconds.
Explain what? 10
10
seconds?
lectures.
And I'm not sure. What do you think? How can we improve it? How can we improve the situation? Because he's so knowledgeable. How can we provide a kind of bridge between his knowledge and your ability? I'm talking about
يا شنو؟
بچه ها از اون پوینت علمی صحبت نمی کنن method of teaching they are talking about method of teaching
شاید اصلا چیز نمیکنه مثلا اهمیت به هر حال بچه‌ها خیلی پایین از اون چیزی که فکر میکنه کار خودشو میکنه فکر کنم مثلا آدمی که چه میدونم روزی 10 تا پی اچ دی داره به خارجی داخلی
یعنی اوور کوالیفیکیشن خیلی کوالیفاید هست
آره میگم در زمان میدم میرم
آره در این سطح ما میدونید یعنی
آره قبول دارم
شما اومدین یه مدت بچه‌ها رو دیدید بعد با سطح بچه‌ها تغییر دادید. ایشون چون اولین بارش بود
I will talk with him.
شکایت بچه از سطح علمیشون قطعاً اون شما دقیقاً فهمید اون بریج کانکشن گفته همه دکتر بعد الدكتور شو مرات الدكاتره اللي كل شيء صار هذا متعود على طلاب البي اتش دي
علميا ما متوازنه.
اي المراحل اللي مثلكم بكالوريوس مثلا دكتور بشرت اول ما شوي غير اسلوبه لحد ما مثلا مو هاي تعرف لان هاي درس الطلاب عراقيين
كلش زين الدكتوره اللي كلش زين الدكتور
What about short-term? Again, no.
No, very good. Very good. Very good, دكتور. شادمين.
شادمين؟
Immunization.
بايوميكانيك شنو مسار؟ دكتور احنا نريد يشاركنا بالشرح يعني هيك يخلينا وياه احنا هو يشرح
دكتور
بگه مثلا بگه بیایی مثلا اصلا توضیح بدی این اینتراکتیو باشه این کلاس.
شادمه اینجوریه؟
نه شادمه که اینطوریه نه دکتر انصاری میگن میگه مثلا یه قسمتشو بگه ما بگیم بعد
Good care. رئیس نمی‌کنه
ولی برای سطح کارشناسی اون اینتراکتیو بودن بیشتر
بهترین آدم برای این درس هیموپلاژیسیتی این آدمه. این آدم یه متدی رو درست کرد که با درای نیدل اسپاسیسیتی رو کم میکنه. میخواید بگو به بچه‌ها این متدی رو درست کرد که با درای نیدل اسپاسیسیتی تو آدمی که آپر موتور اینجوری داره مثلا سی کرده سرور واسکولار دیزیز داره. آره اینو چاق کرد.